Hello, everyone. Welcome to another episode of Dr. Tashambi Speaks. I am Dr. Tashambi. I want to thank you all for liking and sharing the last video that I made concerning understanding the role of the nurse preceptor. And as I indicated to you all on the previous video, I would do a part two. So today we are going to get into part two of understanding the role of the nurse preceptor. I do want to give a couple of reminders just to you all. Please remember that for the people who have 2020 renewals for your license, please be sure that you have all of your contact hours in place. So if you are abstracted, there will not be an issue with you in terms of providing the State Board of Nursing the necessary documentation that they're asking and that they require to ensure that you have met your contact hours. I also want to thank you all for the folks who order books. My book, I have a book, it's entitled Zoe's Secret, and that book can be purchased on mynursementor.org. It's a children's book. She's in the 8th grade. And in the book, we do talk about, just to kind of give you a little clip of it, we do talk about her and her desire to attend nursing school. So if you have young people who may be interested in nursing, I highly recommend Zoe's Secret. So let's get into the topic for today, understanding the role of the nurse preceptor. So I want to give you some points just for people who are accustomed to having a nursing instructor, and maybe you haven't participated in any type of orientation in a hospital prior to you receiving your nursing license. So once you receive your nursing license, the orientation itself can be a bit rigorous depending on the area that you work in. It could run anywhere from 3 months to 6 months, and sometimes even when they let you out after 6 months, you are still under tutelage from someone from time to time, and they typically will give you a resource. So let's just kind of talk about some of the things that the role of the preceptor, some of the things preceptors are responsible for. So number one, they're responsible for teaching you time management. The preceptor, there's a goal that must be met. The nurse should be able to work up to, depending on your shift, sometimes they want you to be able to take care of maybe 4 or 5 patients, depending on the shift that you do work on. If you, of course, orientation starts out on day shift, it can transition to midnight shift. And on midnight shift, because there's less staff, there's less going on, typically there tends to be less nurses. So on days, maybe they might tell you that before you get out of orientation, you need to be able to manage a care assignment, and that care assignment might entail anywhere from 4 to 5 patients, depending on the area that you work in. So they're looking to see, first of all, do you get there on time? Are you prepared at 7 o'clock, not walking through the door at 7, but prepared at 7 o'clock to receive report from the midnight nurse? Once you get report, you also, when you're getting report, they're looking to see if you know how to query the nurse going off duty about specific things. Like, let me give you an example. If a nurse tells you that the patient's hemoglobin is 5 or 6, and that person is not a Jehovah's Witness, and they don't tell you anything about this 5 or 6 hemoglobin, then you should be asking questions about those type of things. So what you're doing in orientation is pulling all the information that you've learned from your nursing programs, and you are implementing those things inside of that care environment. They're looking to see if you are able to pass your meds on time. Typically, they'll start you out with 1 patient just so you can get a feel for how the days go. Of course, we know things differ. If people are sicker, if people have to go for different tests, there could be a little more rigor associated with your actual shift. But the goal is really to see, are you a good time manager? Next, they want to look to see, do you know how to prioritize your patient care? After you get report in the morning, if you have a patient who's going, say, for a cardiac cath, one of the things you want to make sure is you want to make sure that patient is ready. If they tell you that patient's going for the cath maybe at 8 o'clock, that really should be the first person that you go to see. You want to make sure that person hasn't eaten anything, even though the nurse on midnights may have told you they've been kept NPO. You want to ask that patient for yourself. Have they eaten anything after midnight? There's different paperwork, checkoffs that have to be signed. You want to find out based on where you work, does the person have to do the consent with the physician on the unit, or is that something that's done when the patient actually goes to the cath lab? I do know that after a patient is sedated, they are not permitted to sign a consent. So you do want to find out the hospital policies and the things that you will be required to do when your patient is going off the floor for a specific test and OR and things of that nature. Another thing the preceptor is looking to make sure you do is they really want to make sure you know how to document. There's certain required documentation that has to be done in the hospital the same way it was in nursing school. You have to make sure you do your assessment. Even if you don't do the vital signs and the techs get the vital signs, you need to look at those vital signs. If they come and tell you that a vital sign is abnormally low or high, or the person has a temp, that's a bonus. The State Board of Nursing is expecting techs to gather data. It is not their responsibility to interpret data. Therefore, you should be monitoring those vitals when those vital signs go in the computer. Maybe you have a patient who's on restraint monitoring. That has to be indicated in the computer. If you released the person, if you gave them water, if you turned them. All of these are different types of assessment documentations and documents that have to be filled out. If you work on a unit and you accept stroke patients, do you know how to do your NIH stroke scale? Typically, they will put you in a course, you'll take a test, and you just implement that particular skill in clinical. There are certain time frames that things have to be done, and like I said, the preceptor is looking to make sure that you are following those specific guidelines. Are you able to teach your patient? They're trying to look to see, are you teaching the patient about their medication? When it's time for them to be discharged, do you communicate to the family member important things about different aspects of the patient's prescription? Maybe a certain treatment the patient needs done. Maybe they need to have a dressing change done. You need to be able to demonstrate that you can teach that patient about that particular skill or that particular thing that has to be done. And these are some of the things the preceptor will guide you through, but they're also looking to see what you bring to the table. Being a nurse and being in a hospital and having a preceptor, that preceptor is not nursing school all over again. They are teaching you how things are done in their particular healthcare organization. They do want to promote clinical reasoning with you. So when we talk about clinical reasoning, we're talking about, like, what if your patient has to get a unit of blood and your patient has a temp? What would you do if the patient, and we use the temp as an indicator that the patient might be having a reaction to the blood. So they're looking to see, how would you navigate through something like that? Do you know that you should call a physician, and if the person isn't allergic to Tylenol, maybe give them some Tylenol to break the temp, then see if the temp goes up when the person receives the blood. That could be an indication that the person is having a reaction. So they're looking to see, what type of reasoning do you have? Critical thinking. All right, so they're looking to see, do you know if you pull the Foley out of a patient, you DC the Foley, if the person hasn't urinated in 6 hours. Some hospitals use 6 hours as their time frame. Others might say 8 hours. Do you know that you should be bladder scanning that person? Or does the preceptor have to tell you every single solitary step that must occur throughout the day without you thinking about anything on your own? So you want to make sure you're still in a learning phase. They're trying you out, they're testing you out, and like I tell people, there is a nursing shortage, but one thing about the profession, For the most part, the profession is not desperate. That's why I believe it's always a shortage, because they're not desperate for people who are not engaged and people who are not bringing critical thinking skills to the table. Some things develop better over time, and we do understand that, but you really have to stop as an organization, as a preceptor, and as a manager. If you have a person who's working and everything they do, they have to be told by the preceptor. You want to be engaged. You should be asking questions. They are going to provide you with constructive feedback throughout the course of the day. And then typically once a week, they will sit down with you just to let you know how they feel as far as your progress is concerned. And they will also entertain any questions that you have. So they're looking to see, when we talk about giving you feedback, they're looking at the interactions that you have with the staff, with the PCAs. Do you have a problem delegating to the PCAs, or are you in the room trying to give the bath, take the vital signs, check the blood sugar, give the medications? Because if you're practicing like that, things will slip through the cracks, and you will find yourself at some point experiencing burnout, because the reason why we have these roles broken up into the PCA role, the nurse role, is because one person just can't do it all. So you have to be able to delegate. So that means that you have to have courage, and you also have to know what is the role of the PCA. Okay. And let's look at coaching. One of the things the preceptors do is they support the learner, as far as being able to achieve your personal and professional goal during this training process. They guide you along. So you have to be someone who can take constructive criticism. It's a little different now. You're in the hospital, you're a nurse. It's different, when you're in nursing school. If a professor is kind of holding your feet to the fire and expecting you to do certain things, the schools give you an outlet. They permit you to fill out a form where you can, just later instruct you to rest, because they were trying to hold you accountable in some cases. However, it's different when you are in your preceptorship, because really, who really wants to hear that you didn't pass your meds on time and the preceptor has something to say about it? They're supposed to have something to say about it. We're dealing with a healthcare organization that could potentially be sued if things don't go the way they're supposed to go. So this is serious. This is live. This isn't sim lab. And I just want you all to know that I have seen people on more than one occasion who just didn't make it through orientation. Because you could tell that it was just an accident waiting to happen. So I want you all to know that you are supported, but just take your preceptorship, your orientation, take it very seriously, and show that you are engaged. And if it's something that you don't know, be honest and let the instructor know that you haven't had, or the preceptor know that you haven't had experience with that particular thing. And in most cases, if it is a preceptor that really has the skill, and I would say the art and the gift to precept, they are willing to work with you. Please don't try to act like you know how to do things that you really don't know how to do. If you've never changed a chest tube, or pleural vac rather, you need to let someone know so they can be in there with you to guide you, into things so you don't make errors. So I hope I helped you all with this video that's looking at understanding the role of the nurse preceptor. I do want to say congratulations to you all. You have it inside of you. You just want to make sure that you're confident. Get a regimen, get yourself a schedule, make sure you get plenty of rest, make sure you're eating properly, so when you actually go to your orientation, you will be able to bring your A game. And I just know and believe that you'll be able to do it. So if you have questions about anything else, outside of the topics that I am going to be talking on, just send me an email at Dr. Tashambi Speaks, and I will address your question in the form of an email. Thank you so much. And congratulations again to all of the nurses who are going to be graduating in May.